Hi, good morning, everybody. My name is Stephanie Zamora. I work with the WRHA. I've been there for about 11 years now. I do recruitment, so I recruit people to come work at the WRHA within all of our facilities and programs throughout the city. Today I'm going to be talking about careers as a healthcare aide at some of our facilities. So I'm going to talk a little bit about WRHA and healthcare aide jobs and some of the requirements and educational requirements to do those types of positions. So how many people are here interested in being healthcare aides? A few of you. How many are you interested into pursuing careers in healthcare? A few of you. And the other ones are just kind of hanging around? Just kidding. Okay. So a little bit about the WRHA. Most large organizations in the city have a mission, vision, and values. And this is what the WRHA's is, to coordinate and deliver safe and caring services that promote health and well-being. Our vision is healthy people, vibrant communities, care for all, and our values are dignity, care, and respect. So at the WRHA, we employ about 29,000 people, and that's at all of the hospitals and facilities within Winnipeg. We have 200 health service facilities and programs, and we provide healthcare support and service to nearly 700,000 patients a year. Within the WRHA, we have two teaching hospitals, the Health Science Center and St. Boniface Hospital. There's also the community hospitals, the Concordia, the Grace, Seven Oaks, and Victoria. And then we have the long-term care facilities, Deer Lodge, Misericordia, Riverview. We also have 39 personal care homes, 16 community health and access centers, and we're responsible for home care, public health, primary care, and community mental health. We have a lot of offices throughout the city, and you probably see them as you're driving around the city, and you'll usually see them by the little logo that's there in the corner, and it's one of our offices that are there. So for careers in healthcare, you have opportunity, which allows you to help people. Most people get into healthcare careers because they like working with people and helping people. You're not always tied to the desk. Some jobs you are. If you're working in corporate office with the WRHA, you're usually at a desk job. It allows you a good living with a secure future. Everything changes. It's never boring working in healthcare. You're always doing something different. You're always going to be in demand wherever you choose to live. So if you're going to go be a healthcare aide or a nurse or a doctor or a lab tech, wherever you move, you can usually find work. It's one of the things. And you also have a flexibility. It gives you career options from the same education base. So if, for instance, you go to school and you get your Bachelor of Nursing, you don't always have to stay in nursing. You can move into more management type level jobs within the organization. There's always that opportunity for almost all aspects. So if you're interested in being a healthcare aide, you do have to go to school for it. These are some of the programs that are recognized by the WRHA, and they're recognized by providing the necessary curriculum to prepare healthcare aides to work in the WRHA. So these are some of the schools that you can go to get your healthcare aide certificates. Assiniboine Community College, Red River, University College of the North, Herzing, Robertson. And the majority of these people have booths upstairs. So if you're looking at pursuing some education as a healthcare aide, you can go upstairs and get information at most of these places. There's also Maples Collegiate, R.B. Russell. Those are the two high schools, St. James Assiniboine, that you can also take the healthcare aide course at. We also have a WRHA Student Nurse Initiative. So it provides employment for nursing students in a healthcare aide role. So generally, a nursing student is eligible following completion of the second year of the Bachelor of Nursing program or after their first year of an accelerated diploma program. The student's required to submit a transcript and marks for verification that the required courses have been completed prior to an offer of an employment. They can't work in a unit clerk or nursing assistant position unless they have their clerk certification, but they can work as a healthcare aide. So what this allows nursing students after you're finished your second year is it allows you the ability to work during the summer because you're off from May until August. A lot of students look for work over the summer. So if you're already in healthcare, a lot of our facilities will post jobs around March or April, around this time of the year. for healthcare aides that are geared specifically for second-year nursing students. That way you can work over the summer. So I know a lot of students who are currently taking nursing at the U of M on Red River, and they come and they work for us after their second year. So if you are looking to go and pursuing a education as a nurse, there's always your options for summer employment. There's also a prior learning assessment and recognition. That's a formal process for evaluating the credentials of an applicant who does not immediately meet posted requirements. So if you took another course that is equivalent or similar to the healthcare aide course, you can go to Red River and do a prior learning assessment. So they'll review the curriculum of whatever course it is you took to see if it meets the requirements of a healthcare aide, so you don't have to go to school twice for the same thing. You have to do that. You can do that through Red River or Robertson College, and there's a fee for it. But I don't believe it's a large fee for that. It changes every year. And then that way, your credentials and your prior learning and work experience will be evaluated on a case-by-case basis by the college. And then you'll be advised as to what the action needs to be taken. Sometimes you'll need to take a couple of more courses in order to get your healthcare aide certificate. Other times, a lot of your requirements will meet it, but it's usually up to Red River, and they determine that. So some of the qualifications to be a healthcare aide: you have to have your completion of your high school, Manitoba standards. You need a healthcare aide certificate from a recognized college or educational institution. You need your CPR training, they call it the Friends and Family CPR training. If you want to work in intensive care unit and emergency, you need to have your current basic cardiac life support. Previous patient care experience is required, and then just general skills and abilities to perform all tasks, be fluent in English, and be able to assist with all assigned duties. And the reason why it's so generic is because every healthcare aide position that you apply for will have different requirements. You'll always need your high school, you always need your healthcare aide, you need some experience working with patients, but depending on the unit and where you're working, if you're in geriatrics or if you're in emergency or ICU, you'll need different qualifications for those positions. So some of the duties that healthcare aides do, and this is just very generic, as I said, because each unit will require you to do different types of things. Basically, what you'll be doing is assisting the unit nurse in the bedside care of the patient. You'll report and record outputs as required. You'll assist with lifting, turning, and ambulating patients as directed. You need to maintain a safe and clean environment for healthcare, which means wiping up spills immediately, maintaining adequate supplies, assisting in the collection of specimens, assist with admitting, transferring, and discharging patients, and then reporting observations to the unit nurse. All of our vacancy information for the WRHA at all of the hospitals, all of the care facilities, all of the ones that I had spoke about earlier in my presentation, they're all available online. So even if you're considering careers outside of a healthcare aide and you're looking at possibly being a lab tech or an x-ray tech or a unit assistant or admin support or working in corporate office and finance, it's a good idea to go to our website, the wrha.mb.ca, and just take a look around there. You'll be able to find, you can go on the careers website and then pull up postings and say, well, maybe I was thinking about being an x-ray tech. And then you can go and take a look, see what x-ray techs do and what kind of qualifications are needed. And in most cases, the salaries are there as well. So it's always a good source of information if you're considering a career in healthcare. Take a look around, see what it's about, how much money you can make, where you could be working, what your hours are going to look like. All of our jobs are posted online. Some of the facilities have job boards at their sites. And there's also career information. Manitoba Health has really good career information if you're looking at pursuing careers in healthcare. They have a lot of information on their website. So when you're looking at postings, there's types of the positions, casual and term opportunities. We find that when you're applying for healthcare aide positions, the competition, there's a lot of people who are healthcare aides that are looking for work. So when you apply for these positions, there's upwards of at minimum 100 people applying for one position. So it's really difficult to pick up a full-time permanent job because you have other people who are currently working there at a lower EFT applying for those positions. So it's really good to apply for casuals and terms. You can usually pick up a couple of casuals or part-time positions to make up a full-time, and you'll make enough full-time hours. So Casual and term positions, people who are currently working there don't want those types of positions because they're already in them. So you're more likely to get your foot in the door by applying for those ones. But like I said, even if you pick up a term or a casual, you'll usually get enough hours to make up a full-time position. When you're applying for your jobs at the WRHA, and this is summer employment, healthcare aid jobs, whatever you're looking for, it's really important that you tailor your resume to each job that you apply for. Highlight your experiences and how they match the qualifications in the job. So there are postings on site. There's usually at the very beginning the qualifications. So just make sure that you put in there you have your healthcare aid, you have your high school, you've been working with patients for 2-3 years, for however long it is. If you're selected for an interview, that you'll always get called. And our posting positions, it takes a while, so when the closing date, it usually takes anywhere from 4 to 6 weeks after the closing date before you hear anything, and that goes for almost all of the positions within the WRHA. Always make sure that you have your references. It's always good to attach them to it, that way you're not running around trying to get them if you get an interview. So when they're selecting and hiring into these healthcare aid positions, the majority of them are unionized positions. We do have collective agreements within those positions, and seniority is considered a factor when selecting people for these positions. So like I said earlier, we have casual and term employees, part-time employees right now who are applying for these permanent full-times, and their seniority is considered. So if you're applying for a position and somebody who's already been there who has seniority, and you both have the same qualifications and experiences for that position, the person who has the most seniority will get awarded the job, as opposed to somebody who is not working internally already. So that's why it's always good to apply for those casual and terms to get your foot in the door and start gaining seniority hours so you're able to compete for these full-time positions. Some of the benefits that we have working with the WRHA is we have really good pension plans. We have employee assistance program benefits through Blue Cross. We have group health, dental, group life, disability, rehab plans. Casual employees are not eligible to participate, but when you're on a term or in a part-time position, you are eligible for your benefits. So each site, wherever you're applying or get a job at, they will do their own orientation process with you. You'll have a tour, they'll go over policies and procedures, and each unit that you work on will have their own orientation when you're there as well, because every unit works differently.